Hello, I'm David Alvey, Mayor of the Unified Government of Wyandotte County, Kansas City, Kansas.
And I'm Quentin Lucas, Mayor of Kansas City, Missouri. We are honored to be with you today to share a special recognition for a group of folks in our region who went above and beyond their call of duty this past year.
Ensuring the safety and security of the public's health is of the utmost importance to city and county governments. And for that, we rely on our public health departments. Public health works every day to strengthen communities by preventing illness and improving health.
They use science-based interventions to serve entire populations, but with a focus on those most vulnerable. From food safety to immunizations, disease surveillance, maternal and child health to injury and violence prevention, our local public health departments address core public health needs and the root causes of diseases.
The last 16 months have been unprecedented and quite frankly difficult for all of us in Kansas City. And when the pandemic hit in our community, we needed to look to those that we could trust to give us the science-based information that we needed in that time and over time. And that really has been our public health leaders throughout this region. And I can say from a business community standpoint, it was so critically important for our 2,000 plus members for us to be able to provide that kind of trusted information that public health could give to us to share with our business members to help keep us safe during the course of the pandemic and even through to today, and making sure that we can recover and be healthy again. Public health really rose to this occasion in an unbelievably extraordinary way.
We are fortunate that the public health departments in the Kansas City area have a long history of cooperation. The Metropolitan Official Health Agencies of the Kansas City area, commonly known as MOHACA, and the Regional Homeland Security Coordinating Committee's Public Health Subcommittee have been meeting regularly for years.
By collaborating and planning at the regional level, these agencies increase their effectiveness and become stronger together. And this coordination is especially important in our bi-state region, as many people may live in Missouri and see a doctor in Kansas, or vice versa. This makes regional cooperation a necessity to protect public health.
Regional partnerships are key in fighting a pandemic because COVID-19 does not know boundaries, does not know political boundaries, and so we were often consulting our regional partners. Mid-America Regional Council played a crucial role in bringing us together. We have a variety of groups, whether it's communication folks or public health folks or managers or elected officials that Mark helps bring together regionally. That's crucial in a pandemic because if you're on one side of a county line or one side of a state line and you have a different set of rules and expectations for your community, it becomes confusing. We weren't always able to match up. We tried where we could, but we at least had the communication to understand the implications.
This foundation is built on years of hard work and collaboration, and it has never proved more important than in the face of the COVID-19 pandemic. Despite years of declining revenues, our public health department stepped up in a big way and are leading us through this critically important response to a major disaster. Their recommendations about protective actions and business and school closings, which we know were never taken lightly, were based on research and data. Public health recommendations were always made in the interest of protecting the residents in the region.
Well, they're definitely heroes to take on the challenge. I was more impressed with how the health directors navigated through the politics of this whole pandemic and continued to do their job and held on to their professionalism and didn't compromise. And I really think that is what impressed me most, is that I say, what are you seeing? What do you think? Which way should we go? Let them lead you. And I thought that was the best way to do it.
They took swift and decisive action to mobilize testing and contact tracing and vaccination events. And they continue to do an outstanding job communicating with elected officials, business leaders, and the general public about why certain actions continue to be necessary to keep us all safe.
I think it's so important as we begin to see what we hope could be, just maybe, the end of the pandemic, or at least the end of the restrictions and hopefully the pain and suffering we've known so much over the last year and a year and a half. I think what we have to remember is that it's not over yet. We use this example sometimes when we talk about it at KU. Don't fumble the ball at the goal line. you're just about there. So don't forget to follow those rules of infection control, because they still keep you safe wherever you go. They travel with you wherever you go. And that's how we can help us make sure we end this pandemic. And your public health officials, you know what? They talk about this all the time. So we still have to work hard to keep each other safe. We can do that by taking care of each other. That's how we're going to bring in the end of the pandemic. And that's how we don't fumble the ball at the goal line. Let's score this touchdown. Let's win the game.
As you've heard, our 11 public health departments played a crucial role in their response to this pandemic. They are working around the clock, keeping departments focused on stopping the spread of disease while also keeping up with ongoing responsibilities. And they've stayed focused on their work at the local level while also coordinating at a regional level. There is no doubt that their dedication and hard work helped save many lives, perhaps including our own.
To the directors, staff, and volunteers from public health departments across the region serving our communities, we thank you. Today, we want to recognize your service and say we appreciate your ongoing commitment to the health and well-being of our communities.